Do it over. We'll start it from here.
Okay.
Welcome, everyone, to our podcast. My name is Ryan. I'm here with my co-host, Lavit. We are both people who work in the social justice industrial complex, and our podcast is all about talking about and discussing and trying to figure out that the social justice industrial complex, the industry we both work in. Good afternoon, everybody. It's afternoon here in Canada. I think it's earlier in the afternoon in California. And you're here with Social Justice Incorporated, Ryan and Lavit's podcast, where we talk about the social justice industry and the professionals who work in it. So here we're going to talk about a few recent news articles that have come up in my home province, Ontario, but that probably have some relevance to a lot of other parts of the world. And then Lavita has a subject she wants to discuss, which definitely comes out of current events in the LA area, but not really a specific article, because all the articles on it, I think, are pretty just standard, pretty basic news coverage at this point. So the first thing we're talking about is healthcare shortages. So in Ontario right now, like a lot of other places in the world, there are a lot of issues going on in the provision of healthcare. And the two articles I have both come from the CBC. So one is an article August 4th by Alison Jones, titled "Ontario Regulatory Colleges Have 2 weeks to find ways to register foreign trained nurses, doctors faster." And the other one from today says Ontario isn't ruling out privatization in healthcare. Here's what that could look like. And that's not written by any author. So I'm going to start with the first one, and then we'll kind of talk about the maybe somewhat predictable way that it led to the second one. It's really been building in the news that there are a lot of dramatic wait times and staffing shortages and so on going on in Ontario hospitals, and maybe most pronounced in emergency rooms, but apparently it's just going on kind of across the system. And there were examples of hospitals basically closing their ER because they were saying they couldn't staff it. So one kind of dramatic announcement the government made as a way of kind of trying to address this, supposedly, was saying to the professional bodies, which up here we call regulatory colleges, but I feel like there's a lot of different words people use for them around the world, that admit people to be doctors or nurses practicing in Ontario, basically saying that they were supposed to work quickly to try to admit more people into the profession. And specifically because Canada is a country that receives a fair amount of immigration, the idea is that people with credentials from other countries might be kind of moved through the registration process more quickly. This is something that has a real backstory in Canada. There's like an old cliche, and I think versions of this exist in other countries, of people, go to the big city and they're chatting with their cab driver who's from part of the global south, and it emerges that the guy has a medical degree or an engineering degree or something. And I feel like there's obviously some truth to that, but it's also maybe a bit of an urban legend, or kind of people met somebody once who met that description and they kind of talk about it. But there is a real problem of foreign credentials, especially credentials from not the most obvious, advanced industrial economy, Western states, especially English speaking, really struggling to qualify in Ontario and the rest of Canada. And that's something of longstanding. People often have to spend a lot of extra money. They have to wait a lot of extra time. And sometimes, frequently, they have to go back to school. And on the one hand, you can kind of see this for lawyers because there's parts of the world that have very different legal systems, but a lot of it feels kind of absurd for doctors and nurses when you consider that at the end of the day, like the human body doesn't dramatically change depending on which continent or hemisphere you're in. And yeah, like most of it, I mean, assuming basic, like language fluency is obviously going to be a part of it. But once you've kind of mastered that, you can probably figure out how to do pretty much everything you did in your home country in Canada in English or French. So it's a definite, it's a definite kind of failure, and it's a long-standing failure that we have. So of course we would never think about it and deal with it in a methodical, forward-looking way. But what we will do is when we're finally in a crisis, then maybe we'll improvise a solution to it that will totally work. And that appears to be what the government has done here. And it's, obviously people have raised all the obvious questions about whether it will actually achieve the desired effect or anything. So I want to note a couple things about this. It comes in a context where, so the article mentions the fact that Catherine Hoy, who's the president of the Ontario Nurses Association, basically said the step would be beneficial, but also pointed out that back in 2019, before COVID, the wage increases for people working in the healthcare sector were capped at 1% for 3 years. So there's so the union obviously is pointing out that a lot of their members are pretty burned out and are working now for less money than they were working for 3 years ago when you take inflation into account. And that won't necessarily be changed by adding people to the profession. So that's kind of a very, like kind of maybe the most obvious criticism of it, and that without funding generally for the system, adding more people won't necessarily do anything. And in fact, there could be people who are licensed who can't really get hired if that's an issue as well. The system in Canada, to describe it really basically, is public healthcare insurance, with everything else kind of mostly provided either by the private sector or by the nonprofit sector. So there's hospitals. The hospitals generally operate as kind of their own nonprofit corporations. Then there's, a doctor who has a family practice, which is like a small business owner. But they're all charging their services to the same insurer. And those are organized provincially. So Ontario has its own, New Brunswick has its own, British Columbia has its own, and so on. It's different than a more obviously socialized system like the National Health Service they have in the UK, especially before it was kind of gutted over the past couple decades. Frankly, the thing that was probably obvious when the system was set up in Canada in the 1960s and is very obvious today is the system's grossly inefficient. It's not well organized. A lot of the bad kind of perverse market incentives that operate on the medical profession are still present. So we have tons of dermatologists, and we have a huge shortage of family doctors, especially in rural and northern areas. We don't, for example, have enough psychiatrists, especially psychiatrists, who will provide services to low-income people. It's hard for a lot of people to access mental health services. There's huge wait lists for that kind of stuff. But then we have, I can walk around my neighborhood and I can see signs for all the places that are doing like cool sculpting and liposuction and Botox and stuff like that. So it certainly doesn't meet anybody's idea of what a kind of socialist healthcare system would be.
I can tell you that that's not what we think of when we think of Canadian healthcare at all. That sounds like LA. Yeah.
Yeah.
That doesn't sound like what Americans' view of the Canadian healthcare system is.
It's certainly better. Like, as a Canadian, it's really hard to imagine that you could be in the US and you could be a person in your 20s or 30s with, a job that you don't necessarily think is that great, but at least it has some benefits. And then you get laid off. And you're probably your first question, which is a question that doesn't even occur to you if that happens to you here, is for the most part is like, well, what am I going to do for basic healthcare?
Yeah.
A lot of people have benefits tied to their job because there's a lot of stuff that healthcare here doesn't cover, like dental, physio, those kind of things. So you're still potentially losing out on stuff that really matters to you, especially if you have certain conditions. And a lot of drug stuff is not covered here. So that's something you could be losing out on as well. So I don't want to trivialize that here, but it's a different level of fear that hits you if that happens to you in the United States. And Lavit, correct me if I'm wrong, but my sense is Obamacare. This is gonna sound crazy, and if anyone's drinking coffee or tea while they're watching this, do not take a sip. But Obamacare didn't fix all of that, is my sense.
Yeah, you're actually right about that. I know that's a shock to our audience, and there's a shock to everybody in Sublation, but Obamacare was not the golden ticket to healthcare that, even though, as President Biden said, it was a big fucking deal.
Ladies and gentlemen, the President of the United States of America, Barack Obama.
Thank you, everybody. Thank you.
It's a bad system. It's better than some, probably worse than most, and has really kind of been progressively run into the ground by kind of chronic underfunding and just mismanagement. Kind of anecdotally, people you would just hear, someone's somebody has some minor in your social circle, broke their arm or whatever, and they went to ER and it's they're waiting 10 hours and stuff like that. And occasionally these nightmare stories where somebody's, waiting at an ER and they just die. Number of examples in Canada of that happening in a racialized way, right? With really horrific cases of Indigenous people being neglected when trying to receive emergency care or kind of turned away on suspicion of just being drunk. And of course, the person wasn't drunk, or they might have had some drinks, in their system, but they had a really serious health problem that didn't get addressed. COVID obviously made it a lot worse. And in pretty much every Western country, a huge part of the justification for lockdown measures and other stuff was, well, we got to save the healthcare system. But I think in Canada, in Britain, there was an emotional content to that probably wasn't present in the United States, because a lot of Canadians have this real kind of nationalist attachment to the healthcare system. It's very easy for right-wing critics of Canadian healthcare to be it actually sucks. By comparison, you're proud of this and it's worse than probably every European country's way of doing it. People often get mad at that because they know that these right-wingers' prescription for it is just to privatize a bunch of shit, which is obviously worse. But the criticisms are usually on point. This article is interesting to me because it does show something that we've talked about before, which I think a barrier to a really effective healthcare system is the credentializing of it. And this is a more concrete example. People who obviously were able to go to med school or go to nursing school, but in the wrong country. And as a result, there's significant barriers to them doing it in the country they've immigrated to. Incidentally, the fact that they were doctors or nurses was almost certainly a big part of what allowed them to come to Canada, because Canada, like every Western country, has a pretty selective, fairly racist immigration policy where it takes a small number of people in every year out of everyone who wants to come. There's sometimes you have this idiotic thing where you're being allowed into the country because you're a doctor, and then it's you can't work as a doctor. What would I say about the actual approach that the government is taking? Well, it's probably fine on its own, but it's grossly inadequate. What we should probably look at is the way we train doctors and nurses here, because basically we don't produce enough domestically. Of the ones we produce domestically, we lose a bunch to burnout, or we lose a bunch to them just not really wanting to do the job they've been trained for. And then we lose a lot to the United States because a lot of doctors can make more money if they go to the US. So a huge chunk of Canadian med school graduates will wind up in the US. That's something they've been talking about since I was a kid, this like perceived brain drain of Canadian doctors to the US.
I feel like it's a lot of what a right-wing critics say here as well. That like,
Yeah.
well, we're getting all of Canada's doctors. They're all coming over here.
Yeah. And again, it's like it's maybe bad faith criticism, but it's probably like it's true. And it's also true that like wealthy Canadians go to the US to get medical care, right? Because they don't want to wait. But I mean, Americans go to Mexico to get fucking insulin.
Obviously we know USA is number one, always number one. But I guess we're talking about your country right now. So
Number 7.
Number 7, lucky number 7, but not number 1. So what do you think the left critique of this program will be, and what are the weaknesses of that left critique? Because that, I feel like, will either be the downfall of this program or the downfall of the left. So,
my main sense is like people point out correctly that a simple regulatory change isn't going to do that much. And then the prescription, especially with raising the frozen salaries of the nurses and so on, is basically throw more money at it. And just so nobody can misread what I'm saying or whatever, like I basically support the idea of putting more money into the system, obviously, because it's very underfunded. It's been underfunded for a long time. But some of that is throwing good money after bad because of the way the system is structured. It, as I said earlier, is a grossly inefficient system that doesn't deliver a lot of the most essential care that people want. And I'll go back to that there is a surplus of certain, shall we say, less urgently needed medical professions and a shortage of basic family doctors, and probably also a shortage of surgeons in a lot of areas, certainly a shortage of psychiatrists and so on. So it all kind of, to me, points back to kind of one of the kind of points that I think the left, socialists should always be raising, which is the power and importance of planning. Because in Canada, in Ontario, we have an unplanned system. I mean, number one, Canada is a federation. So in most times, if you're talking about something in Canada that's stupid and you're kind of trying to figure out why it's that way, the federalism is going to be a part of that. It's more true in the United States, where you have like 50 plus jurisdictions, but it's true in Canada, where you basically have 10 plus the 3 territories. And it's very, very stupid. Certain things like healthcare, which could easily be coordinated nationally, are not different. There's no there's probably some cases where certain conditions are more prominent in one part of the country than the other, but overall, basically the same healthcare needs are common from Vancouver Island to Newfoundland. And the fact that it's divided up into 10 provincial systems, a lot of them really small, like 150,000 people live in Prince Edward Island, about 500,000 people live in Newfoundland and Labrador. These are modestly sized jurisdictions that have to operate their own legal systems, education systems, healthcare system, all that kind of stuff. Is kind of stupid. So basically the problem is planning. And again, like in Toronto, there's people refer to it sometimes as Hospital Alley. It's a section of University Avenue, one of the main streets in downtown Toronto, where there's just all of these hospitals one after another. And I think a lot of North American cities have something kind of similar to this, but it's a very striking feature when you're in Toronto. And the goofy thing is it's all being paid for by the government through the public health insurance. And yet the hospitals are different. They have different, kind of corporate identities. And the most striking thing, if you know a little bit about how these hospitals work, is they all have a huge number of administrators who are making mid to high, probably 6-figure salaries, running these places when it could all be a lot simpler and a lot more rationally planned in a way that prioritized patient care over members of the dreaded acronym, the PMC, having cushy jobs. And we spoke earlier about the problem with like medical school, which I think is real. People do it, they go through it, they basically mortgage their entire 20s, they spend a lot of money, and then most of them at the end of that, because they've done something not a lot of people in society have done, and they spent a lot of money on it in a way people haven't, consciously or unconsciously, they feel entitled to a good job, good status, good income. And I think one reason why there's probably so many hospital administrators is because that is something that takes you away from providing, care. You're not going to be on call in the same way, not, having to stay on top of things in the same way in terms of research and stuff like that. It's a problem we see in the entire nonprofit sector, in universities, but to me, it's especially crazy in hospitals because, again, what do you need? You need points of delivery. You need them basically everywhere, right? Nobody should be too far from an ER. Nobody should be too far from a family doctor. Nobody should be too far from specialist surgeons. If they are far, there should be an efficient system in place to move them. And that should really be the focus, right? Beyond that, a lot of it just becomes corporate bullshit, bureaucracy, and kind of, people maintaining their own little sandbox.
I just have a question, Ryan. Why do you hate us so much?
You mean you don't conflate your ethno-religious background with the medical profession. No, what do you mean, Lavit? For
Us
real,
PMC professionals are just trying to rise in the corporate hustle and bustle, and while helping people out. I don't see what your issue is.
I guess like what I should say is don't hate the player, hate the game, right? Like I don't necessarily, there's people I know.
You should hate them.
Yeah, but like there's a really good movie. It's actually not actually that good, but it's memorable for me. It's a German movie from about a decade ago, and it's set in East Germany in the 80s. And the idea in it is there's a woman who was like a really talented doctor in Berlin at like the best hospital in East Berlin, but she's like kind of a dissident, so she gets sent to like kind of a smaller city, almost like a small town, where she has to work in their local hospital. And she meets this guy who's like an attractive guy who's like a really devoted doctor, and they sort of like form a romance. And there's this scene where she's kind of like complaining about the fact that she has to work for the state. And she's kind of quoting from some lecture about, the workers and peasants of this country, paid for your education and now you have to pay them back. And she's kind of rolling her eyes at it. And the guy, is supposed to be kind of a true believer in the system. So he's like, that's not actually incorrect. And it's not incorrect, right? If you get an elite education, probably most directly your parents paid for it in North America, but a lot of it was subsidized by the state to some extent and by society in different ways. And you're able to do what you do because a lot of other people are doing things which you probably regard as a lot more banal, but which are essential to the operation of society. And so I think in that sense, people do kind of owe it, but especially we should take, if we want to really get towards a more democratic society, it shouldn't be about how much money your parents can spend on your education. It should be about what do we need? Who's qualified to do those jobs? Your education is funded, but then you pay it back by kind of working socially. And, we would have fewer Botox injecting dermatologists, but we'd probably have, lower infant mortality in Detroit and other things that we sorely fucking need.
I have a question, Ryan. Do you want Los Angeles to fall apart? Like, is that your goal?
Yeah.
Do you personally want to destroy my city? That is our foundation. Okay.
No, your city has so many other things. Like if we got rid of this, there would still be poke bowls. There would still be guys with annoying voices,
And
um,
girls.
and
And
girls.
girls.
There would be what are some other characteristic things like
Homeless people dying in
weird?
the street.
Well, I mean, no, the whole my scheme here is to get rid of that, but
Oh, got it.
at the price of the dermatological profession or whatever. But no, but also we need dermatologists, right? Obviously, it's just like like only some of what they do, right? And like probably the least profitable. Just like we would still need plastic surgeons, right? But you would need
Yeah.
them for people with like cleft palates, people, burn victims.
Yeah.
Like, there's nothing wrong with being a plastic surgeon, but what you shouldn't be doing is, printing money by kind of, mangling rich people's bodies or, like that kind of. I feel like this is a very 90s critique. Like it's almost like unfashionable now to complain about plastic surgery, but like, elective plastic surgery is kind of like, it's hard to justify when, a lot of people don't have enough food and can't get the most basic medical care.
Well,
Can't get insulin, can't get fucking their wounds cleaned and stuff like that. Like,
yeah, but why don't they just get a better job?
right, hit the books.
Ben Shapiro did really just that was his answer before. Like, then why don't you just get a better job? So that's what
I mean, like somebody's got to, find some guys on Skid Row and have them apply for internships at his non-profitable news thing network. Is it even a network or is it just like a YouTube channel or whatever? But
maybe we could be on it and we could be like the two dumb libs or what leftists.
yeah, I'd do it.
You would.
I mean, but like,
I would be like hate fuel for them. They would just take one look at me and like people would totally hate watch. They'd be like, "This SJW, what the fuck is she gonna say?"
Yeah. Whereas those dumb videos where it's like, nobody knew they had like a beautiful voice until they opened their mouth. Like it's like type thing. And with mine, it'd be like nobody knew this like square-looking white guy was left wing until he started like popping off. But yeah, it could go either way. But yeah, I don't know. I mean, that might be more kind of just ranting than like real analysis. But I do think the thing that's depressing is a lot of this stuff was really apparent in 2019. And a lot of it became more apparent in a savage way where it was obviously costing people's lives during the COVID era.
Right.
And that, is considered over to some extent, not over, depending on who you talk to. But a lot of people, I think, in society have kind of moved on. But the problem persists, and the problem is not going away. And the problem is, in many ways, only going to get worse. And in terms of any sort of, like in Canada, there's like a left-wing political party that has seats in parliament and is currently running, I think, only one province, but probably soon up to 3 provinces. Like they certainly don't have any real prescription to deal with any of this. They at best will spend some more money on it, give the nurses and to a lesser extent the doctors a raise, and otherwise pretty much just keep the crappy system going, right? And it's not like your car doesn't need an oil change. Your car is fucked. You got to get rid of your car and get a new car. Get rid of the, tear up the kind of improvised, profit-oriented, pseudo-public healthcare system we have in Canada, or the just completely insane one, which costs more in the United States, despite being the more private one. Get rid of it, rebuild, and rebuild in a way where the priority is actually providing healthcare to, everybody.
I remember when 2020, when COVID first hit, I was contacted by a professor I had to do a panel for people who were first responders during COVID. And so we did one in April 2020, and then one, I think, in maybe 6 months later, and maybe shorter. I don't remember exactly the time frame, but it was a panel with all these first responders, and one of the things they asked was, well, what do you think is going to come out of this? And and I was like, well, clearly whatever healthcare infrastructure we didn't have isn't working. And hopefully, what I would hope is that this motivates people to make actual change in the way that we delineate healthcare in this country, and realize that the for-profit model does not work for anyone. And that our wellness is connected, because people were all freaking out about people experiencing homelessness getting COVID, because it God forbid would have affected them. But there's no system in care for people who have no insurance or have no anyway experiencing extreme poverty. But nothing has changed. In fact, it's gotten worse. The bureaucracies have gotten worse. The available care has gotten worse. Clinics aren't even opened. So, yeah, things are just really bad, but we're still number one. So don't forget it.
Yeah. Never defeated, never bested, never excelled. One thing you said that I think, like you kind of touched on there, was like people's fear of getting COVID from, for example, like kind of homeless populations and stuff like that. And that was, I think a really ugly thing about the early days of the pandemic, but you still see it. I mean, it's clear to me that if there was like a cholera outbreak, but people were told, well, don't worry, it's not going to cross the 10. A lot of people would be like, fine. Like, I'm not going to
Totally
support any spending of money on this whatsoever. And similarly here, like once it became clear that mostly, I think people who were getting sick were either in long-term care homes or working, the people who were staying at home and were, young enough and wealthy enough that they weren't in a long-term care home, did kind of seem to really lose. Not everybody, of course, I'm not saying, but like it, there you had a sense of that, let's say.
Yeah. It was kind of like the same thing with, when AIDS broke, and people thought that it only affected, the gay community. It wasn't until, straight people started getting HIV that they had to actually acknowledge that it was even happening, right? And we still haven't learned. And that's what's the most frustrating thing, is this is not the first time it's happened. But we still haven't learned that, like, everyone's wellness, and I hate that word, but it is the appropriate word to use, is connected. And that when we can keep everybody healthy, we really can all be healthy. And your access to care should not depend on your income. But that's the system we have. And like you said, it's nothing. I mean, in Canada, maybe it's slightly better, but nothing has changed here at all. In fact, it's gotten worse. It sounds like it's gotten worse in Canada. And it sounds like people are trying to figure out, like, maybe by credentialing these physicians and nurses sooner, but also without making the kind of sweeping changes that really need to be made in your healthcare system, like removing all profit. That's really I think that's really where it begins. Like, you can have all these, it's like cutting off the head of the hydra and then 10 more grow back.
Yeah.
Until you remove profit from healthcare, none of these things will really matter. And I mean completely remove profit. Like, there should be absolutely no profit attached to giving people life-saving care. And that doesn't mean that the people who are giving that care should not be compensated or paid. I don't think anybody is saying that. Of course, that's how people will twist it. But the idea that there are stockholders that have more decision-making capabilities than the doctors who are providing care is symptomatic of a deeply sick society. And that's 100% what's happening here.
I mean, the fact that anyone who can make money off it has the ability to control the price of insulin is sick, right? Like that, that's like, you've got a society that, by the combination of inactivity and a horrible diet, with corporations just knowingly pumping people full of sugar and other stuff that's going to make them more likely to get diabetes, it's a major thing in American society in a way that it wasn't necessarily like 50 years ago, the number of people who require it. And then it's like, okay, and then we'll also like profiteer, like shamelessly exploit you, for life-saving medicine. Like it's, this might sound reductive, but it's like, you've just got to get rid of that. You just got to make that not a thing. And the final thing I would say, about this in terms of, like what you said about, okay, yeah, everybody deserves to get paid for doing their job. But I really would put it to people, like, how much more do you deserve to get paid than everybody else? Right? Like there's no hospital if somebody doesn't clean it. Right.
Absolutely.
Like, and like clean out the bedpans and stuff like that. Right. And dispose of the needles and stuff like that. So you may say, well, I have more skills, blah, blah, blah. What I do is more complex, blah, blah, blah. Like I deserve more. How much more? Do you deserve, if your salary is, let's say, $400,000 as a conservative guess, and their salary is $40,000, you deserve 10 times more than they do. They make enough that they put 80% of their income towards their rent in some large urban areas, and you can afford to buy a house and maybe even a second vacation property. I don't necessarily want to take this away from any individual or anything like that, but people do need to think about that. Like, what are your expectations, and how are those, how would those be calibrated to a more just society? And to some extent kill the idea that just by virtue of being the best at school for the first quarter century of your life, you're entitled to so much wealth and privilege. A lot of doctor bashing on this episode, and I want to be clear that I don't really see it as doctor bashing, but I do think, just as with my own profession, there's some really serious changes that need to be made, and those are policy changes, but also, for a lot of people, attitudinal changes that they should consider. And especially that they would, if we had a society that was going in a different direction, they would have to be thinking about, and they would be confronted with in a more immediate way than they are now. I want to give, the sort of a tribute or shout out at this point, something we've never done before in the podcast, but just through the Wikipedia front page, I learned about somebody who died recently. Zahia Mantouri was an Algerian physician and government official, served as the Minister of Health and Social Affairs in that country in 1992, which is, I believe, just around the time where the horrific Algerian civil war was beginning. Basically, she was somebody who came of age as Algeria became independent after fighting a very bloody and heroic struggle for independence from France. She studied medicine. She volunteered to provide healthcare in rural parts of Algeria. And if you know Algeria, there's a couple cities on the Mediterranean, and then it's overwhelmingly a kind of huge but very rural country. She set up pediatric intensive care units in several places, also taught other doctors. To me, that's an example of what a doctor as kind of public servant and a servant of the people would look like. And she, from what I've read about her here, held to her values, tried unsuccessfully as healthcare minister to institute free healthcare in Algeria. And then during the Civil War, was working in a hospital, and among the many people she cared for was a 7-year-old girl whose throat had been slit, who was brought into Mantouri's intensive care unit. Her family had all been killed by one of the Islamist groups in Algeria, the Islamic Salvation Front. This little girl survived. She was in the hospital for about 8 months and then was adopted by Mantouri and her husband. And apparently is considered responsible for training all the pediatric anesthetists in the west of the country. Zahi Mantouri died July 12th, 2022, after making a huge contribution to her country and to humanity overall. So, not against doctors by any means, but aspire to make something resembling that contribution, a fraction of that, and you will have done good work.